New technology has revolutionized diagnosis and treatment for substance abuse. Addiction contributes to the death of more than 500,000 Americans a year. Learn the science of addiction. Next on Living Smart. Hello, I'm Patricia Gras. Welcome to Living Smart, the show designed to help you get the most out of life. Are vaccines the answer to addiction? Our guest today, psychiatrist Dr. Tom Kosten, is leading the research on the cocaine and other vaccines. As one of the top addiction researchers in the nation, he'll explain the science of addiction and how it offers hope for better treatments. How does cocaine affect blood flow in the brain?
So what we're seeing here is it basically decreases it substantially. This is a healthy control on the top. This is a cocaine-dependent person on the bottom.
Dr. Tom Kosten has been researching addiction for the past 30 years. He and his wife now head the first human clinical trials ever conducted for a cocaine vaccine. They are also developing a vaccine for methamphetamines and nicotine. Their smart partnership began spinning on ice over 30 years ago.
Well, I finished up medical school. She then finished up her degree, and then while I was at Yale for my residency, she did her PhD at Yale in neuroscience. When normal people look at
After medical school, while working on his PhD in neuroscience, Kosten realized there was more to research than he envisioned.
I enjoy the patients. They tend to be younger often. They tend to have major problems that are developing from the addictions, but at the same time, they are problems that are remarkably responsive to treatment.
Kosten credits the investment in basic science for the new breakthroughs in substance abuse treatments. Today, over 20 million Americans suffer from addiction each year, and understanding the science of it may ultimately lead to effective treatments.
It has traditionally been thought of as a moral failing, something that willpower can make better. If you work hard enough, to some extent, a religious transformation, can help you. Now, that's not to say that none of those things are important. They're all important. But what's been much more fundamental is understanding these drugs of abuse alter your brain in very fundamental ways. There are a variety of things that happen in your brain that, in fact, are very hard to reverse. So it's a brain disease.
Kosten uses different approaches on his research. Neuroimaging techniques to detect and treat cocaine and measure its pharmacotherapy outcomes. Immunotherapy, which focuses on medication development. And the genetic response to drugs on pharmacogenetics.
We've now been able to identify a couple of genes that seem very important for not only the development of addictions, but for treating it. Yeah, so I think that makes the likelihood that you may be a carrier of this particular genetic variation reasonably high. If you have these specific genetic abnormalities that we've identified, we actually have medications that work.
This patient has struggled with both alcohol and cocaine addiction. Like many addicts, there's a genetic component to his addiction.
I started having probably sips of beer from my father. I idolized alcohol because that's what men did. They drank, at least the men that I was around. My grandfather was an alcoholic. That disease eventually killed him.
The only way you'd get sick with naltrexone is if you were addicted to opiates already.
Today, this man has many more choices than he did only 10 years ago.
The newer medications that we have, the camprosate, like naltrexone, these have a much broader effect in decreasing people's craving for alcohol and decreasing people's desire for it. On the cocaine side, we have developed a vaccine. The vaccine blocks the effects of cocaine. So if you have a slip, that is, you use a modest amount of cocaine, you won't get any reinforcement from it. You won't feel high from it. And actually, why don't we try to move that down a little bit over?
Kosten is able to see the efficacy of a vaccine through new MRI technology by looking at blood flow in the brain.
We get an idea of what areas of the brain get activated. We then can give them a treatment medication and see if the treatment medication changes that. And so this is a way that we're looking at what are essentially brain pathways of learning, where they've learned an association between seeing alcohol, seeing cocaine, and that overlearned brain pathway, can we alter that with a medication?
Kosten has been collaborating with Russian and Chinese scientists in his research.
It's about a quarter the cost to do a study in Russia or in China compared to the cost of doing a study in the United States. They're losing a generation of people, essentially, to these drugs of abuse. And their governments are actually quite concerned about this, more concerned that the U.S. government appears to be about its drug problems. And this was done with the 3 tests, this magnet, right? Mm-hmm.
Kosten finds new discoveries in the addiction field have given many hope for treatment, but the understanding of the nature of the disease in society lags behind.
I think the part that's not as bright is taking what we have now come up with as a variety of medication and medical treatments and trying to use them in the community. That the healthcare system in the United States for addictions is very poor. It's like having a third world healthcare system inside of a first world country.
Thank you so much, Dr. Kosten, for being with us.
Pleasure to be here. Thank you.
We appreciate it. I think that what's happened in the last couple of years is very important for the study of addiction and has to do with the science of addiction. How has it affected the way we look at addiction today?
I think that the major thing that has gone forward is a view of addiction not as a moral failing but as a brain disease. And that seeing it as a brain disease gives people hope, first, that it can be treated, as other diseases are, but also that it's not a personal failing that they have. It's not something they can be blamed for. In fact, it's something that they should feel they can get treated for and feel hopeful about.
And later we'll talk about treatments, effective treatments, but first I want kind of a definition. What is drug addiction?
Well, drug addiction is a word that often has a pejorative meaning to it. That is, people, again, have a certain connotation of a moral or a personal failing that they had. But it is a disease. It's a disease that's produced by using a very large amount of a drug over a prolonged period of time. And when that happens with any substance of abuse, when you stop the substance of abuse, there's a withdrawal syndrome that occurs, that is, you get sick when you try to stop it. And there's also a tolerance that develops so that the same amount of the drug doesn't produce what it used to produce.
The same high that it used to produce.
The same high, or even to give you a simpler example, when people are treated for pain with opiates, as they take more and more of the opiates in order to treat their pain, cancer pain, whatever it happens to be, they need to take the pain medication more frequently, and they need to take very large dosages over time. It's a normal phenomenon that occurs with all of these drugs. And so it's not a manifestation of no willpower. It's a manifestation of what basic pharmacology and neurobiology are about.
Again, the science of addiction. It's a different threshold that
It
you're
is.
going up every time. Why is adolescence a critical time to prevent drug addiction?
Well, adolescence in particular before age 17 or 18 is a very critical time because your brain is still developing. And the part of your brain that's still developing at that age is the frontal cortex, the area of the brain that's very much involved with inhibition, that is inhibiting the behaviors that the lower parts of your brain, what we call the midbrain, are generating. And those midbrain parts are the same ones that we share with the reptiles, with the lower amphibians, with animals who, when they see a fly, they just go for it and eat it. Humans are a little better than that. We generally can inhibit that impulse, but it's the frontal cortex that does it. And if you interfere with that maturation, which is what happens when you use drugs in the early teenage years, that maturation process never happens normally.
Okay, so it does affect the brain chemistry. It changes the brain chemistry much more in an adolescent than an adult.
It will, unfortunately.
Okay. What are the risk factors of addiction?
Well, there are certainly a wide range of risk factors for addiction. One of the ones that people often think about is the family history. That is, there is a genetics to it. We know that 70% or so of the risk for becoming addicted is, in fact, a heritable characteristic. Now, heritable will not mean that there's a single gene for it, but there's 25 or 30 genes that are most likely involved, and there are probably hundreds of variations in these genes, all of which, in the right combination, or wrong combination, I suppose, you would in fact develop the disease. So that's the first thing. So that you're born with. The second, of course, is that just being born with something doesn't necessarily mean you develop it unless you're exposed to the agent that's going to make for the disease. So, for example, you can be at very high risk for developing certain infectious diseases, but if you never encounter the bacteria, you never encounter the bug, you'll never get the infection. So similarly, if you have all these risk genes in you, if you never drink alcohol, if you never use cocaine, if you never use opiates, you will never develop the disease. And it's not simply small exposures to these drugs, it's large exposures to them. So that many, many people, for example, would use opiates but don't become opiate addicts.
Well, and that leads to my next question. You see that in the Native American community, apparently there's a gene and they're more susceptible to alcoholism. Is that correct?
The Native Americans actually have several genes that are related to their alcoholism. One of the genes that we've discovered that is related to them developing alcoholism is a very interesting gene variant because in general it's related to geographic location. That is, the farther north you are in the hemisphere, the more likely you are to carry this gene variation. Initially that was thought to be very peculiar because most of the Native Americans are now not in Alaska, but in Phoenix, Arizona, or in places that are very hot. Right. And we often think of American Indians as being there. But in fact, all of the American Indians came to the North American continent across the Bering Strait. They were, in fact, a group of people who were from northern China and Russia that became American Indians.
Right,
now, this is many thousands of years ago, and that's when these gene variants were introduced into our population.
Is addiction voluntary? I mean, why is it so hard to quit?
Well, addiction being voluntary is certainly true from the standpoint of you have to make a decision to use the drug. There's no question about that. Once you develop an addictive process, though, many parts of that no longer are voluntary in the usual sense of it. That is, there's a driving force that's stronger than your cortical inhibitions can be, that is, that brain area, that will keep you seeking drugs. And in order to stop using the drugs, you either have to greatly strengthen that cortical inhibition, which is the kind of behavioral therapies that we use, or you have to pharmacologically, that is, use medications to repair the damage that's there. And to just come back to the adolescents again, this is a particular issue with adolescents where they've had these pathways damaged early on, so that you're not simply repairing them, you in fact are regenerating them. And that takes a lot more effort than if you're rehabilitating something that was there before and now you bring it back to function.
For you as a doctor, is it easier to treat adolescents or adults? I mean, give me some examples of some of the patients that you've dealt with.
Well, certainly it's often thought about that adolescents are a very challenging group to work with. Well, some of the patients that I've worked with in the past will come into, there was one of the boys that was in a residential program we were treating. He'd had a terrible history. He had begun using alcohol when he was 11 years old, about the same time began using inhalants, was inhaling gasoline, and both of those things had done some significant damage. By the time he was 14, he was living on the street by himself, and while he was living on the street, he got arrested a number of times and eventually ended up in our residential program. He stayed in that residential program for about 8 months. During that time, because it was a confined place in which we did urine testing for drugs every other day, he didn't use any drugs and he didn't leave the facility. In that setting, and at this point he was about 17 years old, he really did make a great deal of progress. He was going to school every day within that facility. He was getting rehabilitation in terms of some of his motor skills that had in fact deteriorated. Right. So he had trouble playing baseball or playing sports that are, in a simple way. And so we had to teach him some of those physical activities. And that was a result of some of the destruction that had happened from the inhaling the gasoline. So with that particular boy, you would say, well, that was a great challenge. I mean, there were so many things you felt like you had to fix. But at the same time, at the end of the year, because of the plasticity that your brain has at that age, he made tremendous progress. He eventually was able to go back to a high school, got a high school diploma. He, of course, not altogether surprisingly, decided he wanted a career in addictions and became a counselor.
So you've seen a lot of great stories.
You see very...
Even though we do know that it does affect the brain a certain way and the brain can't regenerate, explain to me how addiction affects the brain and if there's no going back once the damage has been done.
Well, I think that one of the things we've learned in the last 5 years is that one of the statements made that the brain doesn't regenerate is in fact not true. That the brain can in fact regenerate, that you have a large number of cells in your brain that in fact are sitting in particular areas that are ready to become brain cells. They are undifferentiated, they're like embryonic cells that are in your brain, and that has given us terrific hope, and these cells are particularly lively when you're younger. The older you get, the fewer you have of them. And because of that, we do have great hope that we can, in fact, show these kinds of dramatic changes in adolescents when we give them sustained periods of abstinence and we give them a variety of medications that, in fact, stimulate that growth. They also stimulate that growth in profitable directions. That is, these nerve cells could start growing, but if they grow back randomly, and to give you an example of that, we had a patient of ours that came from California at the time while I was in Connecticut, and he came with another group who were very interested in showing us that MDMA, that is ecstasy, was in fact perfectly benign. Not only was it benign, but it was good for you. So they came to us when I was at Yale, and they had us do a whole series of tests on them. To, again, give you a little example of one of the people who came in, he was someone who had graduated from Ivy League college. He had gone off to Los Angeles, become an advertising executive, was, from all our standpoints, very successful. He had his 2 Mercedes-Benz, he had 2 kids, the 2 dogs, a cat,
the American family. The
American family, American dream, had made a great deal of money. He was now coming to us, and what he was doing now was selling jewelry on the streets, handmade jewelry on the streets of Los Angeles, was relatively homeless, had divorced his wife, of course given up his job, and when we assessed his IQ, he had an IQ of it was around 102. Now, a normal IQ is around 102, but I don't think that he graduated from his Ivy League college with an IQ of 102.
Right.
And part of what happens is this ecstasy as a drug damages neurons. It damages them from the end of the neuron towards the body of the neuron. The neurons can grow back. They grow back, but they don't grow back to where they used to be. They grow back randomly.
Right.
And that's the problem.
Now, so this is a chronic disease, isn't it? It's sort of become like cancer, where you have to treat it for the rest of your life. Right? It's not curable, is it?
Well, I think that it's very much like cancer. I think that 50, 60 years ago, cancer was a very stigmatized disease, and institutions like MD Anderson did a great deal to unstigmatize that disease, to begin the dialogue about talking about treating it, about how you could make it better, and understanding the risk factors for it. I think we would now still have to say that many things about cancer are uncurable. But there are, in fact, half a dozen cancers that are quite curable, and even ones that not necessarily are childhood cancers. And I think we would need to say the same thing about addictions, that addictions are, in fact, chronic, relapsing disorders. There are a large number of people who have self-cures. 20% or so of people who would get quite addicted are able to stop on their own. Now, I say on their own, they often make use of Alcoholics Anonymous, they make use of non-professional aids, and it's very helpful. The majority don't, but there's some that do. The other thing that's important to recognize is most people who use drugs don't become addicted. The most addictive drug we know of is nicotine. That is, for every 3 users of nicotine, 1 of them becomes addicted. When you talk about heroin or opiates or cocaine, the numbers are more like 10 or 7 to 1, that users who then become addicted. So in fact, many of the other drugs of abuse are not that addictive.
Can addiction cause mental illness?
Addiction is very much associated with mental illness. The most common disorder that you will see associated with addiction is depression. So that the rates of depressive disorders in addicted patients are typically 5 to 10 times higher rates than you'd see in the community. Similarly, if you have significant depression, the rates of addiction, of getting abuse of drugs of various sorts, is higher. Not as high as going the other way. Does it cause the depression? Withdrawal from most drugs of abuse gives you a depressive-like syndrome that tends to resolve in a week or 2. The other people who have persistent depression, more than a couple of weeks of depressive symptoms, they certainly have a depressive disorder. They certainly benefit from antidepressant treatments, whether that's a medication or a psychotherapy. So did the drugs cause the disorder? It certainly precipitated the disorder. It does not help.
Let's talk about a new drug epidemic, addiction to painkillers. How serious is this?
Addiction to painkillers has become an extremely serious problem. It is now, and since 2005, has bypassed marijuana as the most frequent drug that children, that is between the ages of 13 and 21, are most likely to use as their first drug of abuse. It's not alcohol, it's not nicotine, it's not marijuana, it's opiates. So the question you say is, well, how is this possible? Well, opiates are one of the drugs that are free. How are they free? They're in your parents' medicine cabinet. They're on your grandmother's kitchen table. When you ask people who are particularly the abusers now, the new age for abuse is under 15, that's the median age, and they're more frequently women than men, that is girls than boys, which is very atypical from what we expect, say, from heroin addicts. When you ask them where they get the drugs, they uniformly tell you they're getting it from their parents or one of their relatives. It's not the internet, it's not other sources. So that's the big drug of abuse. Can we do things about it? Yes.
Keep the drugs away from them.
The major thing to do is after you get your pain medications from the dentist or something else, you dispose of them. Yeah, and right. I have to say that even those of us who are professionals in the field are not very good at this. Just to give you a small example, about 3 years ago, I had a root canal done, which is not the most pleasant experience, and my dentist told me that, I know you're a tough guy, but we're going to give you some pain medications for this. I said, no, thank you, I don't want them. He said, yes, you're going to get them. I said, no, I don't want them. He said, yes, you're going to get them, and I walked out with a 2-week supply of Darvocets. And I was very glad that I got them. I took the Darvocets for 3 days, and they were really very helpful. Without that, I wouldn't have slept. So then the question is, you now have, a 2-week supply, though, of this medication. And so did I throw it out? Oh, why would I do that? I put it in the medicine cabinet next to the aspirin and all the other pain relievers that are there. It sat there. About a year later, looked in the medicine cabinet to shave. Well, I didn't notice that they were gone at first. What I noticed was that something was funny about the medicine cabinet. I couldn't figure out what it was, but I just closed it. I then got a phone call. The phone call was from our cleaning service. And in this particular instance, the cleaning service we had was one that was a contract service, and there was always young women who were coming in to clean it, often different ones at different times, with sometimes more than a few tattoos on them, and not the tattoos that often would hide needle marks and other things.
I gather she went off with the drugs.
She indeed went off with the drugs, and she was found, she had actually overdosed, and that was the reason she wasn't there.
Okay.
Now, the only good news about this was that one of the things that you're going to think about with your children is that if drugs go missing or something, and you have adolescent children paying attention.
Let's talk about treatments. What works? You're working on different vaccines. Tell me how the vaccines work and why that offers so much hope today with treatment.
Well, the vaccines are an intervention that is simplicity in itself. That is, the way that they work is we get your body to make antibodies to the drugs of abuse. Now, ordinarily your body would not do that. Drugs of abuse are very small chemicals, and because they're so small, your body doesn't recognize them as anything that's foreign to them. Instead, it views them like food, that you take them in and you shouldn't make an antibody to them because you don't want to get allergic to the food you're eating. So the way that we fool the body is we take these drugs of abuse and we attach them to other big proteins that are typically found in bacteria. So we take part of the cholera toxin that's not toxic, and it's made so it's an untoxic version, but on that very large cholera protein, we then attach 20 or 30 cocaine molecules or nicotine molecules or whatever we're interested in making the vaccine to. We then inject those into people. When the people then respond to that, they make antibodies to cholera, and they also make antibodies to cocaine. So they now have the antibodies to cocaine. With the antibodies to cocaine in their bloodstream, when they smoke cocaine, when they snort cocaine, when they inject cocaine, the antibodies bind the cocaine in the bloodstream and prevent it from getting in their brain, their heart, or any place else. And you can't get addicted if it doesn't get into your brain.
In the 30 years you've been doing research, is this the most hopeful that you've been?
Thus far, we've had every study we've done with this has been positive. The idea is so simple that to some extent it would be hard for it not to work. The most surprising part for us was that we didn't know if you'd be able to make enough antibodies. That is, could we stimulate? We had to stimulate a very large production. But in fact, your body is capable of doing it. It takes about 5 injections to do that, as opposed to the usual vaccinations you get with 1 or maybe 2 injections. You have to give a number of these, and you have to give it over some time.
Okay, well, how do you know you're living smart?
Oh, you know that I think you're living smart when you realize that if you have an addiction, you need to do something about it.
Okay.
If you have it, the thing to do is seek professional help, get an evaluation done. When you get the evaluation done, realize that there are very good treatments that are available. The vaccine may be one of them. There are others that are down the line coming up for not just cocaine, but a wide range of addictive substances, and that you can get help.
Thank you so much, Dr. Kosten, for joining us. It's great to have you.
It was a pleasure. Thank you.
And for more information on this topic, go to our website. There you'll also find a complete resource list. You can also email us or call us with your comments at 713-743-8513. And that's our show for today. I hope you've enjoyed it. Remember to live smart. I'm Patricia Gras. Have a vigorous week.
For a transcript of this program, send $6.95 to the address on your screen. Please include the name of the guest.